Which drug is used as a first-line vasopressor in septic shock? Dopamine, epinephrine, norepinephrine, none of these. Correct answer is option C, norepinephrine. The most accurate method for assessing core body temperature in ICU is oral thermometer, axillary reading, esophageal or rectal probe, temporal scan. Correct answer is option C, esophageal or rectal probe. Central venous pressure reflects left ventricular function, right atrial pressure, pulmonary artery pressure, cardiac output. Correct answer is option B, right atrial pressure. The nurse must suction a tracheostomy tube for no longer than 5 seconds, 10 seconds, 15 seconds, 30 seconds. Correct answer is option C, 15 seconds. In a patient with hypoventilation, the ABG finding will show respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Correct answer is option A, respiratory acidosis. Which finding suggests effective CPR? Absence of carotid pulse, chest rising, palpable femoral pulse during compressions, no chest recoil. Correct answer is option C, palpable femoral pulse during compressions. The most reliable indicator of adequate tissue perfusion is blood pressure, urine output, capillary refill, level of consciousness. Correct answer is option D, level of consciousness. Propofol infusion in ICU patients requires monitoring for hypertension, bradycardia and hypotension, hyperthermia, hyponatremia. Correct answer is option B, bradycardia and hypotension. Dopamine at low doses primarily acts to cause vasoconstriction, improve renal perfusion, decrease heart rate, reduce contractility. Correct answer is option B, improve renal perfusion. A patient on ventilator develops sudden desaturation and absent breath sounds on one side. The nurse should suspect pneumothorax, pulmonary edema, bronchospasm, aspiration. Correct answer is option A, pneumothorax. The nurse knows that mannitol is contraindicated in increased ICP, acute renal failure with anuria, cerebral edema, glaucoma. Correct answer is option B, acute renal failure with anuria. If a patient's GCS is 8, it indicates fully alert, mild head injury, severe brain injury, normal consciousness. Correct answer is option C, severe brain injury. Which waveform is seen in ventricular tachycardia? Normal sinus, irregular few waves, wide QRS complexes, no electrical activity. Correct answer is option C, wide QRS complexes. The most common cause of sudden cardiac arrest in ICU is pulmonary embolism, ventricular fibrillation, hypovolemia, hypothermia. Correct answer is option B, ventricular fibrillation. Which electrolyte imbalance increases the risk of cardiac arrest? Hypocalcemia, hyperkalemia, hyponatremia, hypomagnesemia. Correct answer is option B, hyperkalemia. The nurse should withhold digoxin if the pulse rate is 90 beats per minute, 80 beats per minute, 70 beats per minute, less than 60 beats per minute. Correct answer is option D, less than 60 beats per minute. The first nursing action for a patient with suspected myocardial infarction is give fluids, obtain 12 lead ECG, insert Foley catheter, check blood sugar. Correct answer is option B, obtain 12 lead ECG. The drug atropine is primarily used for bradycardia, hypertension, ventricular fibrillation, seizures. Correct answer is option A, bradycardia. The most common complication of total parenteral nutrition is hypoglycemia, hyperglycemia, constipation, dehydration. Correct answer is option B, hyperglycemia. When a patient is sedated with midazolam, the nurse must monitor urine color, respiratory rate and airway, skin turgor, vision changes. Correct answer is option B, respiratory rate and airway. A patient with ARDS should be positioned in supine, sitting upright only, Trendelenburg, Frown. Correct answer is option D, Frown. The drug phenytoin is used to control seizures, increase blood pressure, treat hypoglycemia, reverse sedation. Correct answer is option A, control seizures. When administering vasopressor through a central line, the nurse must dilute the drug in large volume, infuse rapidly via bolus, use an infusion pump and monitor blood pressure closely, administer with dextrose 10% solution. Correct answer is option C, use an infusion pump and monitor blood pressure closely. During CPR in an adult, the recommended chest compression rate is 60 to 80, 80 to 100, 100 to 120, 100 to 150. Correct answer is option C, 100 to 120 per minute. The normal range of partial pressure of oxygen in arterial blood is 60 to 80, 80 to 100, 100 to 120, 50 to 70. Correct answer is option B, 80 to 100 mmHg. When caring for a patient with chest tube drainage, the nurse should clamp the tube during transport, add saline to collection chamber, empty drainage hourly, keep the drainage system below chest level. Correct answer is option D, keep the drainage system below chest level. Continuous cardiac monitoring is used mainly to detect blood pressure, heart rhythm abnormalities, oxygen saturation, temperature. Correct answer is option B, heart rhythm and abnormalities. The Glasgow Coma Scale evaluates neurological function, respiratory effort, cardiovascular stability, reflex activity. Correct answer is option A, neurological function. In an unconscious patient, the most important nursing action to prevent aspiration is keep head of bed plate, insert a nasogastric tube, position and lateral side lying, suction only when visible secretions are present. Correct answer is option C, position in lateral side lying. The nurse identifies the early sign of septic shock is hypotension, cold clammy skin, decreased urine output, tachycardia and warm flushed skin. Correct answer is option D, tachycardia and warm flushed skin. The physician recommended for shock management is Trendelenburg, Fowler's, supine with legs elevated lateral. Correct answer is option C, supine with legs elevated. Which of the following is a late sign of hypoxia? Cyanosis, restlessness, tachycardia, anxiety. Correct answer is option A, cyanosis. A patient in ICU is on continuous cardiac monitoring. The nurse notices ventricular fibrillation. The first action should be administer epinephrine, start chest compressions and call for defibrillator, check lead placement, none of these. Correct answer is option B, start chest compressions and call for defibrillator. When giving IV potassium, the nurse must give as a bolus, store in sunlight, mix with dextrose only, infuse slowly with monitoring. Correct answer is option D, infuse slowly with monitoring. The primary goal of mechanical ventilation is to increase cardiac output, improve oxygenation and ventilation, reduce the infection risk, increase metabolic rate. Correct answer is option B, improve oxygenation and ventilation. Mannitol is used in ICU to decrease ICP, increase urine sodium, reduce fever, control seizures. Correct answer is option A, decreased ICP. Thanks for watching. Subscribe to the channel for the latest informative MCQs.